Good afternoon, everybody. Excellencies, ladies and gentlemen, dear friends, dear ecosystem of Geneva, welcome to this fourth iteration of the So What series, the series of the SDG Lab, which was launched actually just a year ago. And today we mark also the first anniversary of the SDG Lab, and it's a pleasure to see still a full room on this full anniversary, and I think it's a testimony to all the great support we've had from all of you throughout this year, so welcome. I'll shift just a little bit the choreography of the meeting to give our Director General the chance to give a few remarks before he has to rush to another meeting, and then I'll get back to you. Director General, thank you so much for being with us this afternoon. You have the floor.
Thank you. Thank you, Nadia. Excellencies, Mr. Leyendik, I think I said the right way. Ladies and gentlemen, a very warm welcome and thank you for being with us, and welcome to the fourth iteration of the SDG Lab So What's series. I'm very happy to see you today and to see so many of you. 1 year after the official launch of the SDG Lab, it's really wonderful to see the shared enthusiasm and interest for the work of the lab and for the work around the SDGs in this extraordinary ecosystem in Geneva. It testifies to the unprecedented energy in this city towards engaging on the SDGs and doing so in a collective way. You are here as practitioners in your sectors or organizations and as pioneers of a collective movement towards breaking down silos, promoting integrated approaches, and creating transformational partnerships. All those elements are essential for the implementation of the 2030 Agenda. And this is what the SDG Lab's activities are aiming at: translating the universal, indivisible, and multi-stakeholder DNA of the SDGs into practice. And today, you will be looking at the linkages between SDG 6, Clean Water and Sanitation, and SDG 10, Reduced Inequalities, and listening to concrete examples of the benefits of doing so. And I really hope that this event will be a source of inspiration and will contribute to shifting our mindsets towards appreciating what breaking the silos actually means in practice. As SDG 6 will be reviewed in this year's high-level political forum in New York in July, we also hope our discussions today will contribute to the reflections in New York later on, in next month. And I very much look forward to hearing about what the speakers and you come up with and learning about their experiences and the lessons learned. I thank very much the WSSCC for co-hosting this event, and I thank UNOPS and UN Water for partnering with us. This is the spirit of the SDGs. Thank you for being here. Over to you.
Merci. Thank you very much, Director General, for your constant support and your leadership on the SDGs and supporting the Geneva ecosystem, and not least the SDG Lab throughout this year and all the many years to come. As the Director General underscored, the SDG Lab is about connecting, convening, using the convening power of the United Nations to bring together the diversity and the beauties of this city that is Geneva. The sectoral expertise which you all in a form or another represent, the opportunities that we have to make linkages that in no other city we can do, to incubate partnerships that wouldn't happen because we're not all together at field level, but here we are all together. And last but not least, a lot of key decisions are made in this city that have direct influence on how we can better support the implementation of the SDGs at country level. So the SDG Lab is a convener, a connector, an amplifier also of practices that are demonstrating impact at country level. We're just as interested in successful practices as well as practices that may not have brought the results that were expected, but that have allowed for lessons to be learned and for recalibrating or retailoring certain projects or programs for success. This is really the spirit of the lab that we are, is to understand the ingredients of success as well as understanding the ingredients of so-called failures. We're also a question asker, so a lot of people talk about the SDG Lab as being a space, right? A space for unexpected questions. And this is what the event this afternoon is all about, is about using this safe space, which is the United Nations, to talk about issues in a very sort of pragmatic way. We try to move away as much as we can from acronyms, and please call on me if I mention any this afternoon, or just try and also go more in depth when, we hear so many buzzwords around the SDGs, right? About we should be engaging with the private sector, or we should be thinking and acting in an SDG way. What does that actually mean in practice? And this is what this afternoon this beautiful panel will be trying to translate through their examples. The SDG Lab is also an innovator in many ways. The team itself is a totally multi-stakeholder team. We have representatives from the International Institute for Sustainable Development, an NGO, with Kaylee Tyler here represented, diplomats from Nigeria. Chichi is here this afternoon. We also have representatives from the UN and also academics in our team, which allow us to be mutually also challenged out of our comfort zones within our team. So today, the So What series is about all this, about convening, connecting, amplifying, asking questions, and innovating. And as the Director General mentioned, today is about crossing SDG 6 on ensuring availability and sustainable management of water and sanitation for all, with SDG 10 in reducing inequality within and among countries. And as we all know, both these goals are very broad and have a subset of very specific targets, right? So obviously this afternoon we won't be able to tackle every single target through concrete examples, but what we hope to achieve is to be able to demonstrate through practical examples how we can mutually accelerate the targets under both of these goals by working through a same lens which connects SDG 6 with SDG 10. So I'll be bringing a few facts and figures later, but to set the stage of today's conversation and correlation between both those goals, let me just quote the UN's 2018 synthesis report on SDG 6, which was prepared for the High-Level Political Forum. And I quote, "Estimates suggest that if the natural environment continues to be degraded and unsustainable pressures put on global water resources, 45% of the global gross domestic product, 52% of the world's population, and 40% of global grain production will be at risk by 2050. Poor and marginalized populations will be disproportionately affected, further exacerbating rising inequalities. In addition, equal access to sufficient, safe, and affordable water and adequate and affordable sanitation and hygiene can mean the difference between prosperity and poverty, between well-being and ill health, and between living and dying." On this note, I would like to give the opportunity now to our co-host, the Executive Director of WSSCC, Mr. Rolf Luyendijk, to make a few introductory remarks. Thank you very much, Rolf.
Thank you very much, Nadia, and good afternoon, everyone. Thanks for coming, and thanks for letting me kick off. The Water Supply and Sanitation Collaborative Council is a small outfit that focuses exclusively on SDG 6.2, on sanitation and hygiene. And I know we have a wonderful panel that will also talk about water and other things, so let me focus on hygiene. Before I begin, I have to apologize for any foul language I may use, because when you talk sanitation, we tend to call things by the name. So you'll recognize it when you hear it. I'll focus on two things, because we were asked innovations and equity and leaving no one behind. So I'll come up with an innovation from the field, how we do sanitation actually in practice. And it's very different from what many of you may think. But first, the SDGs, SDG 6.1 and 6.2 have inequalities ingrained already in their language. It talks about access in an equitable sanitation. It talks about special attention to women and children and girls, women and girls and people in vulnerable situations. So when it was formulated, we had people from the Human Rights to Water Supply and Sanitation, the Special Rapporteur, on the team to actually help the formulation. So inequalities is very much ingrained in SDG 6.1 and 2. Before I start, also a couple of figures. 886 million people still practicing open defecation, according to the latest figures from WHO and UNICEF. 886 million people without any toilet, going to the bushes, to the field. 2.5 billion people without a basic toilet that meets certain standards. Yet a 36% impact of sanitation on the reduction of morbidity of diarrheal disease in children under 5. 36%, 1 in 3, more than 1 in 3 episodes of diarrhea prevented. 23% impact of hand washing on acute respiratory infections. Child killer number 1 in the world. 23% by just washing hands with water and soap. 23% impact on stunting and manifestation of malnutrition. Exacerbated by repeated infections of the gut by fecal pathogens. And it's all by sanitation, simple, I'm going to say the word shit that we're talking about. Okay, on that innovation. Many of you may still think that sanitation programs are about educating people how important it is for their health and their children's health to have a latrine and construct a latrine, and maybe we give some slabs and some bricks and some cement and some vent pipes. But actually, 10, 15 years ago, a new innovation came up. Innovation built on the work of Robert Chambers, Participatory Rural Appraisal, Paolo Freire, Adult Education, and actually it's a community-based approach. And I want to demonstrate that to you. Unfortunately, I can't demonstrate it live, but I'll try to give a good impression. So, for those familiar with community-based approaches, it's participatory rural appraisal very often starts out with making a big map of the community. In a space this big as we are here. Make a big map, where are the roads, where are the houses, where's the mosque, where's the water point. And then we say, where do you defecate? Where do you go to the toilet? So, I have a toilet. It's good you have a toilet. You put next to your house, you put a little yellow patch for toilet. And you, do you have a toilet? Me? No, I don't have a toilet. So this is an approach that uses shock, shame, and disgust that eventually leads to people constructing their own latrines without any subsidy. So you didn't have a toilet. So where do you go? Me? Shocking. On the map, I go there. Well, the lady gets then some yellow powder and goes there and sprinkles some yellow powder where she goes and does her business. And they do it with all the community members. Where do you go? So on that big map, you see a yellow patch there, you see a yellow patch there, yellow patch there. And then say, okay, let's go for a walk. Let's go and visit those yellow patches. In real life, not on the map. So they go real life and they go to those yellow patches. And they're going to look for the shit. And say, oh, I found one. Isn't that yours? Shameful, shocked, laughing. My turn next. Yes, and you, sir. That could be yours, right? So, and then they have a discussion. How much shit do we actually produce all together as a community? Laughing, shame. Well, you know, 0.5 kilo per person, 100 people, that's 500, and that's 50 kilos a day. That's about 2 wheelbarrows, right? Yeah. How much is it in a week? 350 kilos. How much is it in a month? It gets difficult like that. Then we take truckloads of shit that you dump in your own community every month. And the shame and the shock of that is tremendous. And people think, well, this can't be, but it gets better. They take one. And they take it back to their map, where they mapped out the village. And then they put a plate of food next to it. And then our friends come, the flies, with their little hairy feet, and they go from flies to shit. And then somebody takes a glass of water, nice, clean, fresh water. And you take a hair over the shit in the water. Who wants to drink? Yes, this one. Yes. You. Who wants to drink that? And everybody said, no, yuck, no. And then people inevitably, there's a discussion, and people think, eventually somebody comes up and said, we're eating our own shit. Now, that's the ultimate. And I see people laughing, and also people being ashamed. So this is the ultimate that people say, well, this is unacceptable, because disgust is a universal value. This approach is active now in more than 80 countries around the world. And then, what can we do about it? And then there's community leaders, natural leaders, people who pop up. We need to have a latrine. Yeah, but if you and you have a latrine and you don't have a latrine, then we all get sick from, and we're still eating your shit. So, community gets together, decides that every household will build a latrine. Now, and that brings us to the second part, the equitable part. Every household. So this approach goes for 100% open defecation-free communities. Every household needs to build a latrine. And if a household can't build a latrine because there's a poor widow living there, or somebody who is less able than others, then the community pulls in and makes sure that each household has a latrine and uses a latrine. And from a 100% open defecation-free community, you go to a 100% open defecation-free district. And for people who worked in the field know how difficult it is to get to each and every community of a district. But if you go for a 100% open defecation-free district, you get the most remote areas, which happen to coincide with the poorest, with the most deprived, with the least healthy. So in this approach is inherently an equitable approach to making sure that even the last mile gets access to this incredibly important basic service as sanitation is. Nepal, fantastic example. Nepal has currently 50 of its 77 districts declared open defecation free. It's a huge, huge achievement. And it aims by mid next year, aims to have 100% open defecation free communities and districts in Nepal, entire Nepal open defecation free. And that is all by using this approach that I just explained to you. The good thing also of going for districts, 100% open defecation free districts, is there's urban areas. And urban areas very often need a different approach. And we have Cheryl Hicks on the team of the Toilet Board Coalition that hopefully will talk about some of the innovations in urban areas, because there these approaches where there's less community cohesion are more difficult to do. But so it is not a panacea for everything, but it's a wonderful way to get going. Last but not least, my organization does follow this approach in various countries. We've reached about 16 million people thus far. Now 16 million on the 886 million is not enough. At a cost of about $10 per capita. So we need 8.8 billion, and actually they're all not living in 100% open defecation free communities, so you actually need, billions and billions more. Now it is our task. It is our task of the development community, private sector and NGOs to actually ready governments to absorb those billions once they come. Because currently we're still in the remit of a couple of million here and a couple of million there. But we actually need tens of millions, we need hundreds of millions. For the sector worldwide, we need hundreds of billions. Thank you very much.
Thanks a lot. You can leave it here. Beautiful photo op. Thank you very much, Rolf. I think it was a very, very compelling statement, and thank you for giving very concrete examples about what we're talking about. I really appreciate it, and thank you again for co-hosting this event and for your leadership. I'd like also to acknowledge again the partnership with UNOPS and UN Water. Our special guests also in the room, please don't hesitate also afterwards to share your insights on this. As we all know, the goal 6 is about water, is about sanitation, is about hygiene, and we'll be touching on those 3 dimensions as they relate to inequality this afternoon. We have a beautiful panel here this afternoon with a mix of government representatives, with representatives from Malawi and Bolivia. We also have the UN family represented here through our colleague from WHO. We also have business-led partnerships represented here through the Toilet Board Coalition, and also entrepreneurship represented here through Nat. I'll have an opportunity to introduce you afterwards specifically. But before we do so, I just wanted to add just a few facts and figures beyond 6.2, just to put the bigger picture in the room, and I'll be very short. 2.1 billion people lack access to safely managed drinking water services, and 4.45 billion people lack safely managed sanitation services. All these figures are WHO, UNICEF, or World Bank sources. Second, children in the poorest 20% of the populations are still up to 3 times more likely to die before their 5th birthday than children in the richest quintiles. Thirdly, the loss of productivity to water and sanitation-related diseases cost many countries up to 5% of their GDP. And lastly, for every $1 invested in water and sanitation, an average of at least $4 in returned in increased productivity. Well, those are pretty striking numbers. There are many more, and obviously this was a subjective selection of just a few to give a little bit the context in which we're operating. Before we go on to our panelists, just a few points on communications. As last time in our last iteration of So What, we'll be using Slido. Use your phones. We won't be mad at you if we see you on your phones. We'll take it that you're on Slido and not texting. Slido.com, the code 9646 to enter this conversation. Any questions you've always wanted to ask on these 2 goals but never really dared to do so, you can do it either in an anonymous way or actually put your name. You can then also support the questions through a like, so that as a moderator I see what are the questions that are gaining most appetite, so that I can bring them up in the conversation this afternoon. I'll also just be reacting to certain of the comments this afternoon and making up my own questions, but it's important that what the audience wants to ask really is at the forefront of our conversation this afternoon. Also, Twitter handle SDG Lab. Please follow us. Follow also our partners. I don't have their handles here, but if you partners, would you like to give your Twitter handle? Do you have any? UNOPS. At UNOPS. At UN Water. _water. Okay, there you go. And then there are a few hashtags there that are written there that you can use. All right, wonderful. Well, first of all, let me welcome you all, dear speakers, and thank you very much for coming this afternoon. This diversity really translates what the SDG Lab is all about, is bringing different stakeholders to the table to give them an opportunity to share their perspective on a matter and to demonstrate that we all have a part of the piece of the puzzle, so to speak, and it's only if we all work together that we will accelerate results in the SDGs. And I'd like first to give the opportunity to Ambassador Salama, a permanent representative of Malawi to the United Nations here in Geneva. Thanking you very much for being here this afternoon to share with us your experience at country level on how SDG 6 and SDG 10 are actually interrelated and what it actually means in practice, also at the policy level, how Malawi has appreciated that connection and what results it has achieved or is hoping to achieve in the future. Could you tell us a few words about that, please, Ambassador? Thank you.
Hello? It's okay?
Works.
Okay. I thank you very much, moderator, for inviting me to be here. As you are aware, I was not supposed to be here. Someone else was supposed to be here. So
we're happy you're here.
Exactly. So yeah, so I was made to be, a stop gap filler, if I may say that. And knowing that I'm basically an ambassador here, I may not be very conversant with what is happening at home, because by profession I'm a trade development specialist. That's my area. So I've been dealing with issues to do with the WTO, really. But I'm also looking after UN things. So knowing that I'm not very conversant with these things, I thought it wise to fly someone all the way from Malawi at my expense. And I hope I'm going to be refunded by WSSCC. Secretary for Health, Dr. Namariga.
Wonderful. Welcome.
Yes. So he's going to be my co-presenter.
Excellent.
And because issues to do with the sanitation fall under the Minister of Health. Mm-hmm. And he's the Principal Secretary for Health, and the sanitation is his area. So he is the right person that should have been here instead of me. Had you known, I would have told, had you told me that you are trying to bring someone here, I would have told you who to bring. So luckily enough, he's here, and he's going to help us to, to say what we are doing in Malawi. But to start the ball rolling, Malawi is a country that is in the southern part of Africa, East Africa, East and Southern Africa to be precise. And we are almost surrounded by Mozambique to the south and to the east, and to the north we have got Tanzania as our neighbor, and to the west we've got Zambia. And the country is 118,000 square meters, square miles, or square kilometers rather, 118,000 square kilometers. And 1/3 of our country is water. And here we are talking of, water issues. So in this regard, we feel that, this is a very good, time to speak about this. But I'd like to say that Malawi is also a poor country as well. The people are the ones who are poor, but the resources are there. And our history goes back to the time when we were a British colony. And we sometimes blame the British for not coming up with us, in a way they were developing other, other countries such as Zimbabwe and so on. So we're sort of left behind. So when we got our independence in 1964, we had a very big, challenge of, improving a lot of things. In those days, sanitation issues were almost unknown. So we had to start from scratch. The government then put a lot of emphasis on hygiene in schools, and we also empowered our local authorities to talk about sanitation or hygiene, and also during funerals and during weddings, we would also talk about the need for hygiene as well, and the sanitation. So the government, I believe, Mr. Namarika, Dr. Namarika is going to say much. We've got now a policy on sanitation that is put in place to drive the issues of sanitation. And unfortunately, as I said earlier on, sanitation is in the midst of health, while water, which goes hand in hand with the sanitation, is in the Ministry of Agriculture. But there are now efforts to streamline, the administration of water within the local government, so that the areas in Malawi are responsible for managing the issues to do with the water. Because we believe that without water, you cannot have sanitation. And we also believe that when these issues of hygiene and sanitation are taken are taken up, and people are aware of what needs to be done, we feel that they will also play a very big role in reducing the inequalities. Because, for example, in education, if you look at the enrollment of schools, they take the demographic setup of our country, where 52% of the population are women and 48 are men. So if you look at the early years of school, you find that there are more girls in primary schools than boys. But as they go on from standard 1, standard 2, and so forth, you find that the ratios now, sort of change. You see that the ladies get fewer and fewer, or less and less, and the boys, become more. So this tends to increase the inequalities because of that. And one of the reasons is, of course, of the poor sanitation and water, because in our cultures, we usually tend to put the girls to do some chores in homes. For example, looking for water, looking for firewood, for energy, and for cooking. So you find some families would rather have their girl child, do those things rather than going to school. So that increases the inequalities. So if there is enough water around, water points and so on, it means that the girls are going to be freed from those chores. Then they can concentrate on their education. So this is one of the areas we feel that the SDG 6 and 10 link. Mm-hmm. Yeah. The other issue also is the fact that if you don't have good sanitation and good water sources, it might also affect the economic, aspirations, because you will see that in most markets in African countries, it is the women that are usually, in the market selling agriculture and foodstuffs. So if they are bogged down to ensure that the families are provided with the water, it means that they will not, participate very well or fully in their economic activities. As a result, the poverty, may not be, achieved because they will not be able to do their businesses. So there are so many areas, but I think I should just ask Dr. Namarika to add a few on these things so that you
Wonderful.
Appreciate really what's happening.
Thank you very much, Ambassador. I think it was wonderful you give that introduction and show also how we are already going beyond just the connection between 6 and 10, or actually just show that 10 is so much more than about 10. It's about also SDG 5. It's about education. It's about economic growth. I think it was good that from the outset came out in our conversation. And welcome to our colleague. Welcome to Geneva. We're so happy that you were able to join us and have country represented. You are representing country, Ambassador, but to have country represented here, especially as you work for the Ministry of Health, we understand. I was also struck when you said, Ambassador, that now you're thinking of closer ties between the Ministry of Agriculture and the Ministry of Health, precisely because you're seeing the matter of SDG 6 or SDGs in general through silos is not helpful. So you're trying to do this. So please, we'd love if you could add a few remarks to what the Ambassador has already said, and how this sort of breaking the silo approach is working in Malawi, or how is it proving challenging also. We'd love to hear also what the difficulties are and how you're seeing, how you want to address them in the future. So I'll give you 3 minutes maybe to give us that introduction, and you'll have an opportunity afterwards to speak more. I just want then to open the floor to him. Welcome.
No, thank you very much. My name is Dr. Dan Namarika. I'm the Principal Secretary for Health. I'm pleased to be here. In terms of the issues that are at hand, very, very pertinent to Ministry of Health, as highlighted in I'm not sure whether that was a keynote address. In Ministry of Health, we know that more than 50% of diseases that present to our hospitals are preventable. Mm-hmm. And in fact, at policy level, what government has done, the recent cabinet approval of the Malawi National Health Policy had to be returned, because when the president saw the first document, he said, you have not done much on prevention. So we went back and we had to redo the prevention part of it. And so from the national health policy, now comes the two policies, one on water and the other one on sanitation. Sanitation is surely under Ministry of Health. And then water is under Ministry of Agriculture, Water and Irrigation. And so that tie is very important, multi-sectoral collaboration. But even further, at the implementation level, we are looking at this trickling down to the community and what the role of the community, the traditional leader, is. So yes, at central level, those are the ministries, but what we want is embracing this concept at the community level with the traditional leader being the champion of water, sanitation, and hygiene. And so let me just give you a highlight. All of you may know the map of Malawi, or the geographical position of Malawi, was highlighted by the ambassador. But last year, from 2017, around November, to around April 2018, the whole region or neighboring countries around Malawi had serious cholera outbreak. Zambia had more than 4,500 cases with about 90 deaths. Tanzania also had another 4,000 deaths thereabouts. DR Congo, Angola, I think a few cases in Zimbabwe, Mozambique. So all our neighboring countries. Malawi had close to 1,000 cases of cholera that were recorded in country. The last cholera case in the country was about 2 weeks ago. But when you looked at the whole cholera outbreak, because we tend to be saying it's a waterborne disease, or sometimes foodborne. But the classical thing about this disease, the cholera outbreak this year, was it was almost purely a waterborne disease. It wasn't food. So you wouldn't go to a street vendor and say, stop the food. No, but it was largely a waterborne disease. And it was the same in Zambia. It was the same in Tanzania. It was a waterborne disease. Even the area that we are dealing with the case 2 weeks ago was a waterborne. Now, yes, the country had been hit by that, but there were differences. The disease in the urban population was different. And in fact, for us in the Ministry of Health, we're really concerned that the urban cholera is difficult. And I think I would be very interested to see what my colleague will be talking about, water issues in urban populations, especially in slums, versus in communities where traditional leadership is very clear. So I think the leader, the governance at local level, which may be quite diffuse in an urban population, versus governance and championing that at a village level where the traditional leadership is really respected. So Malawi, with our partners, embarked on an open defecation-free campaign. So we went back to our communities and encouraged our traditional leaders that we can do it. And we're encouraging people to have own toilets. Mm-hmm. And our traditional leaders really grasped it. In fact, 4 of our districts attained a district-free status of open defecation. And classically, all those districts, almost all of them, had no cholera cases. So there's a direct link. And if you look at those cases, those areas, you'd also see that even incidences of cases of trachoma, which is the eye infection, were not there in those districts. And many other diseases. If you look at, I think in the long term, we'll be looking at stunting and nutrition as long-term factors of it. But even without the oral cholera vaccine, just encouraging sanitation in the 4 districts was clear that we didn't have cholera in those 4 districts. I think later on we'll be talking about menstrual hygiene. I thought that's also one area that is...
Talk about that afterwards.
Yeah, we can talk
really
about
like us to focus on hygiene.
But the issue at hand is, one, you got to have a national policy which is led at the top level. The president was. The First Lady is running her own NGO, Beautify Malawi, which is looking at basically sanitation and bringing back girls into school and retaining them in school. So she's got a BEAM initiative, Beautify Malawi. From there, then it's the implementation level from central, but even more importantly, the local leadership, community leadership, being part of the game and working with us. So that's what has proved to be a success.
So it's the whole closing the loop between high-level political community being
to the
on
lowest
same
level. Now, what we've noted, having our communities having achieved the sanitation or defecation-free status, they need to be rewarded. What they need is water. So let me stop at that they will need now to have safe water because they don't have it. They've, yes, they constructed the toilets, but now they need the water.
So maybe just that last point, I mean, all your points were fascinating, but that last point also of what incentivizes communities to actually go along that route of building latrines, et cetera, and the correlation between access to water. How, at the policy level, how are you making that link? You talk about rewarding. Is there something explicit that's done by government to ensure that water supplies reach that region, or how are you incentivizing communities to go along that route? It sounds almost so easy, but I'm sure it's difficult to change sometimes the mindsets, right? Or just talk a little bit more, if you can, in 1 more minute about those incentives and rewards you mentioned at the end of your intervention, if you can.
So I think the main thing has been that there's been sharing of information among the traditional leaders, and seeing, firstly, issue about dignity, self-dignity by the communities, because people do not realize that just going to the bush just brings them to, I mean, it removes their dignity. So that was the first thing. The second thing, in a few areas, with sponsorship from our partners, UNICEF and others, we managed to give them water. So I think that's another area that was incentivizing the drive to do open defecation free status initiative.
Thank you very much for these first remarks, and we'll get back to you later on. I'd like to give the opportunity now to Cheryl Hicks, the Executive Director of the Toilet Board Coalition, which is a coalition of private sector, so to speak. Talk about a buzzword. Maybe you can break that down a little bit and be provocative with me, please. You have the floor. What do you do? Why is SDG 6 and SDG 10 relevant to
so what
do?
for the private sector, right? Thank you very much, Nadia, to the SDG Lab for this fantastic set of dialogues that you're putting on. It's so important, and to our colleagues on the panel, what you were talking about in incentives and investment is really why the private sector is at the table as well. So the Toilet Board Coalition was formed just a couple of years ago, initially as a coalition of the willing in 2014, and we formalized as a business-led public-private partnership Swiss association here in Geneva in 2016. And the reason why the private sector, and this is perhaps what's different about this partnership, is it was formed by the private sector to also see what they could do to help address the global sanitation crisis. And they formed the coalition of businesses, and that, just to name them, Unilever, Kimberly-Clark, Lixil Corporation, a Japanese toilet maker, Firmenich Corporation, a Swiss flavors and fragrances company here in Geneva, Tata in India, and Veolia, one of the biggest waste management companies. The reason why they formed this coalition is because they saw not only the opportunity to help accelerate the pace of change towards addressing one of our greatest challenges, but also because they saw business opportunity. They saw value left on the table, essentially. And so the Toilet Board's vision is to accelerate a sanitation economy. And in my examples, I'll get to what we mean by that. Our mandate from the businesses is to find, to support, and to co-develop business solutions to the global sanitation crisis. And in doing so, opening up new markets and opening up new opportunities for job creation and for citizen engagement. And these three areas, there's three areas of the sanitation economy which touched on also what my colleagues were talking about in health. And we think this is very exciting. We see a toilet economy as a robust marketplace of many different types of products and services for sanitation that fit all income levels, all contexts. And many of you probably know the work of the Bill and Melinda Gates Foundation on Reinvent the Toilet. We love reinventing the toilet. This is a huge opportunity for innovation, and that's where the private sector sees opportunity, not to mention all of the product opportunities that go along with that. That's the toilet economy. But what starts to get even more exciting beyond the toilet economy, if we think about the toilet economy, access to toilets as the entrance to a much bigger marketplace. That much bigger marketplace is about biological resources. Every business on the planet is constrained by a lack of resources. The SDGs cover that. The sanitation system is one of the only systems where we have an abundance of natural and organic biological resources. And Ralph, talked about the amount of resources per day in the village. Well, we've actually, in a report we put out last year, calculated that by today's population, 3.8 trillion liters of biological resources that we're not capturing, that we're not utilizing, that we're not utilizing as solutions for our nutrient crisis, for our water crisis. All of these things lie within our sanitation system. And this is what we call the circular sanitation economy. Really the valorizing, first of all, and then monetizing of these resources that are in the system and are currently undervalued. We see already examples of companies, for example, mining sewage for water. Examples of this, companies in Brazil. We see in India mining and looking to develop ecosystems of entrepreneurs that can capture sewage to produce energy for communities. We're seeing nutrients for sectors such as the tea sector. We have a new partnership with the Ethical Tea Partnership, where the tea sector in India is under siege from poor sanitation, leaching into the fields and providing poor conditions for workers. They see an opportunity to turn their production into a circular production system and circumvent many issues of health, well-being, save costs for the business, and potentially create new markets. We also see a huge preventative health opportunity in what we call the smart sanitation economy. Everything has to be smart. Sanitation has to be smart too. In the smart sanitation economy, we're very proud to have just announced a partnership with the European Space Agency just in these past days, actually, just this month. And that partnership is about bringing the technologies of space to sanitation and digital health, the digital health opportunity. As was said by our colleagues, sanitation is the biggest opportunity we have for preventative health. And we have all of the information that we need in the toilet resources. So Rolf used other language. We prefer to use toilet resources. A lot of biological resource, but a lot of data and information about human health and behavior in those toilets as well. And so our third example is a project in India, in the city of Pune, to be the first smart sanitation city, working with the European Space Agency to bring technologies that can capture the data and information about human health from community and public toilets for the city, for public health institutions to get a read on what infectious diseases are circulating. Eventually, of course, down the road to commercialize this, anyone that has a Fitbit device and is monitoring your heart rate, the steps that you take by your iPhone, we can also see huge opportunities here for each of us to have the information every day when we use the toilet. What nutrients are we getting or not getting in our food? What diseases are circulating in our communities? So just a snapshot of the world of toilets from the view of the sanitation economy and the Toilet Board Coalition.
Thank you so much, Cheryl. I think all of us in the room will never see our toilets the same way again, right? It's fascinating to see the bigger picture, also the business opportunity of toilets, of sanitation and hygiene and water, and the different incentives, I guess, of different private partners. Some are engaging because these are relevant throughout their value chain, others because they see concrete market opportunities in that sector per se, and all the above. And
And it's driving investment.
It's driving.
So what the private sector saw when they looked at the system was a lot of cost to build toilets, a lot of cost to maintain toilets, a lot of cost for leakages and breakages, and just quite frankly out-of-date infrastructure. And if there seems to be value in the system, there will be investment in the system. But if we can't show value in the system, the private sector will not invest. So that's what the sanitation economy is about.
Fascinating. Thank you very much. And I'm sure you all have questions popping up in your minds. And before I open the floor, don't forget that you do have Slido where you can ask any questions you want to. Get your phones out. I'll be looking. I am actually looking at Slido. You're not very productive this afternoon, so I'm just encouraging you to be a little bit more. And we can also not use Slido. This is just an opportunity because sometimes it's easier to ask questions, especially on all the subjects we're discussing this afternoon, if you're anonymous. But just to remind you, and now I'd like to give the floor to Marina Takane, who works for the WHO, so the World Health Organization here in Geneva. And Marina's working on a UN water-led global analysis and assessment of sanitation drinking water initiative. Thank you for being here this afternoon and for representing a UN organization on the panel. Please tell us more about your work and how both these SDGs and beyond work in your field. Thank you.
Thank you, Nadia, and thank you to SDG Labs and WSSCC for the opportunity to participate in this event. My name is Marina Takane. I work for the World Health Organization. As Nadia mentioned, I work for an initiative called the UN Water GLASS, the Global Analysis and Assessment of Sanitation and Drinking Water. This is a global monitoring initiative that looks at the enabling environment in the wash sector. So concretely, this means that we're looking at monitoring aspects of governance, institutional coordination, monitoring systems, human resources, and financing. This is done that is sent out to countries every 2 years. And we collect information. We encourage countries to go through the stakeholder process to discuss the survey elements and to come up with a national response. GLASS is also a co-custodian of the SDG 6 element that has been introduced in the SDG agenda is looking at not just outcomes, so percentage of households with access to safe water and sanitation and other aspects of the water cycle, but also looking at the enabling environment and what are the means in place to allow countries to make progress towards the outcomes. So that is a important aspect of our work, and particularly target 6A on international cooperation, which is measured through looking at in countries. We do have also a specific initiative looking at financing for the wash sector in countries called TRACFIN. In our 2017 report was a we had 84 participating countries. That countries going through the GLASS process. It's not just to be able to monitor at a global level all of these elements, it's also highlighting gaps in countries as countries go through this process of bringing together different ministries working in the wash sector, development partners, NGOs, that it's highlighting what is known and what isn't known in countries. So really not just looking at GLASS as a monitoring mechanism, but also thinking of it as a process that countries go through to highlight gaps. Slightly more broadly in terms of the WHO role, within the WASH unit of WHO, we also house the WHO-UNICEF Joint Monitoring Program. So whenever you see global figures on which Nadia cited earlier, on percentage of households with access to safe water and sanitation, this is often coming from the Joint Monitoring Program. So WHO's role is quite strong on the monitoring side, as well as on the normative side. So the drinking water guidelines, as well as the forthcoming sanitation guidelines. So from one of the numbers that is actually quite shocking, which Nadia did not cite, is that according to a 2015 report, 38% of health facilities globally do not have access to an improved water source. So soap. So again, think of dealing with a cholera outbreak with no soap in your health facilities.
So you mentioned quite a few. Sorry to interrupt you. I think what's fascinating in your tool also is the gaps that allow to emerge thanks to your work. So you mentioned here an unexpected analysis. Are there any other gaps that are emerging from your tool that allow to sort of totally shift policies in one direction or the other because of unexpected information arising? Can you give us examples?
So as we it can be quite fragmented. So as our colleague from Malawi mentioned, you can often have sanitation and water ministries. You have many development partners working in the sector, and you also have many NGOs working in the country. And I think one thing that the GLASS survey provides opportunity to countries, if such a mechanism doesn't already exist, is to get all of these people in the same room and talking together. So one specific example is our colleagues in Nepal reported that they basically were not aware of, until they had this GLASS meeting, this set of GLASS meetings, they were not aware of so this allowed them to, in terms of advocacy, to be able to go back to the higher level of the ministries and to advocate for greater resources. We've also heard from colleagues in Bangladesh that because they don't have this type of, or they did not have this type of regular meetings, that this going through the GLASS implementation process really allows them to sort of have this reference group of people and to be able to consult each other on
meet otherwise. It's
exactly.
an opportunity that was created.
And Pacific. But really we find that in addition to being a global monitoring tool, it really reinforces the country processes in terms of coordination and being able to connect people at the country level.
It's really interesting you say that, just to bring it to the global level and the high-level political forum. We often think of processes, so to speak, as being processes, but actually what we're often hearing is precisely that, the work that allows to reach the tool or to reach the presentation at the HLPF is worthy as such because it's bringing around the table unexpected partners that wouldn't meet otherwise, and the process itself is very enriching. Let me just dive back at country level, sort of come back to where things are being implemented by giving the floor now to Natalia Pacheco Rodriguez from the Permanent Mission of Bolivia to the UN here in Geneva. Thank you very much for joining us. It was really important for us that we have voices from different continents and regions also. So how does this all kind of translate at country level in Bolivia? What has been your experience in crossing both those goals? Any good practices or challenges you can share with us this afternoon? Thank you, Natalia.
Thank you very much for this invitation. We are very pleased to be here. I should also say Hayaja, which is a salutation from our indigenous peoples that means for life. I think for Bolivia, as well as for many peoples in the world, I guess water is the source of life. And it has not only value for health, but also even spiritual values. In our constitution, water is a human right, a fundamental human right. And this is also the vision that we have been trying to promote at the UN level, promoting a resolution for the human right of water. It was not always the case like that, and perhaps I will very briefly mention a kind of a bad experience we had in the early 2000s, where we had a so-called war of water, where a private company which had the concession for the provision of water services in one of our cities increased exponentially the tariffs for water. And this led obviously to public upheaval because most of the people could not afford, and obviously their rights were undermined. This led to our country to reflect upon the importance of having our strategic resources belonging to the country, to the people. And this is why since 2006, with our new government, we have made all these resources public. And it's the state who has taken the responsibility of ensuring this human right. And for that, we have obviously worked with non-profit entities who have been entitled the provision of water. Putting water as a human right in our country has signified also a big increase in public investment for water and sanitation. And there has been an increase since 2006 until today of more than 80% of our public investment and more than 500% in irrigation in rural areas. This means around 0.5% of all of our GDP, which is a big amount. For us, water and the reduction of inequalities are very much interlinked. And we see that in our objectives and also in the results that we have been achieving since we have been implementing this public investment in water services. We have seen a huge decrease of children mortality of 50%, or more than 50%, and also of
Excuse me, can you repeat that? Because that's pretty striking. Can you just say that again?
Yes, more than 50% of decrease in child mortality, and also more than 50% of decrease in children malnutrition. Obviously, there are many factors, but the access of water is definitely one of the most important. More than 30,000 families in rural areas have been benefiting from irrigation services and the irrigation investments in these areas, which we believe is crucial for food sovereignty. Taking into account, for example, that FAO has already announced that because of different challenges in the world, such as climate change, the rural areas will be facing a lot of the impacts in water shortages. And this is also hand in hand with our policies in the reduction of poverty, where we have achieved a reduction of from 38% to 17% of extreme poverty in these years, from 2005 to 2017. So definitely the goal of water and also sanitation and the goal of inequalities are very much interlinked, not only inequalities within the country, but also inequalities between countries. And this is where I come also to the challenges, to the global challenges that we face, such as climate change. We believe that a collective effort in order to comply with the obligations in climate mitigation and also the obligations in terms of the provision of the means of implementation, including the transfer of technologies, will very much contribute to the reduction of inequalities between countries. Mm-hmm. So this is very briefly a little bit of our experience.
Thank you very much, Natalia, for sharing your experience. And I just wanted to ask you, our colleagues from Malawi highlighted the importance of ministries coming together to discuss the questions related to access to water, sanitation, hygiene, etc. How's it working in Bolivia? How is this policy coherence being challenged or being addressed? Have you made any deliberate decisions after the adoption of the SDGs to have cross-sectoral work or task force? Or Could you maybe give us a few?
Yes, thank you. Yes, definitely these are matters that are interlinked in several ministries. Actually, we have our own development plan for our development goals as well, and we very much receive inspiration also from the SDGs. And in our goals, of course, we have one of these goals is the reduction of inequalities. And several ministries, including the Ministry of Water, we have a Ministry of Water and Environment, also the Ministry of Health in terms of sanitation, but also the Ministry of Finance and Economy is linked. And also something special from our water policies is that we have promoted a lot the participation of communities in terms of water management. So the communities have been provided capacity and training on how to assess and evaluate the systems. And so there is a lot of coordination between the communities and the provider of the service, and also the ministries. And in our country also we have different levels of governance. We have the national, the departmental, and also the municipal level. So these levels also need to coordinate for the provision.
Thank you very much, Natalia. You mentioned also the Ministry of Finance. That's a question maybe I'll bring afterwards to Malawi after our last speakers as an opportunity to speak. But how do you make the economic case? There are so many priorities in the SDG agenda, right, for all countries. How do you make the case with Ministry of Finance that more resources should be put into water-related or sanitation and hygiene issues? But that's maybe a question for you afterwards, how that dialogue is happening or not. I'd like to give the opportunity now to Nat Wong, the founder and CEO of Water Inception. Nat, you're a social entrepreneur, as we say. I'm sure you're even more than that. So tell us more about your initiative and how your work relates to the conversation we're having this afternoon.
Thank you very much, Nadia. So my name is Nat Wong, and I'm gonna just tell you a bit why I'm here today and how I got here in Switzerland and what I'm doing about water and this SDG number 10 too. So first of all, I arrived here in 1980s with my parents. I was barely born, and if some of you know from my name, you can maybe guess that I'm Vietnamese from origin. My parents were actually from the south of Vietnam, and they escaped in 1979 by boat from the south of Vietnam from a little city called Cà Mau. And they arrived to Malaysia, where I was actually born in a refugee camp in Kuala Lumpur. Thanks to the Red Cross across the road, we got the support to be transported here. And when I arrived here in 1980, I was just 2 months old, and I grew up in a little city called Nyong, 50 minutes away from here. And I have to say, a pretty much not a normal life, but I was able to go to public education, and I really, never really felt as a refugee growing up. And I did all my career as more in the web marketing industry. And a year and a half ago, I made a discovery. I don't know if it's my mic, this mic does not, I'm sorry. But I made a discovery of a technology that was invented by a Spanish retired engineer. And we were really impressed because this technology basically can create drinkable water by condensing the humidity from the air. So when I saw the video on YouTube the first time, I was very skeptical. But I wanted to believe somehow. I found this sounded too exciting. I had to find out. So I called the company the next day and made use of my little Spanish to find out that it was real. And if I really wanted to see the machine, that I could fly to Spain and see it from my own eyes and even drink the water from the machine. So I accepted the challenge, and a few weeks later, I was in Spain with the inventor. And he showed me around this technology, which I was able to see from my own eyes. And believe me, it was really an incredible moment for me. When I drank this water directly from the machine, I realized that, we have the technology today to bring water even in desert locations. This machine is able to produce water, drinkable water, from only 8% of relative humidity, which is extremely low. It's desert conditions. Those machines work with electricity. We can actually power them with renewable energies, solar panels, which doesn't lack in desert. And then we can create the water on the spot without having to transport anything by truck directly where we want the water to be. And we can even mineralize the water if they are concerned about the lack of a mineral in the water. So when I realized that, I started looking into the water crisis, which I didn't know much about. I discovered a lot, as I said, a year and a half ago, I was just a web marketing consultant, and then I realized there's a huge upcoming water crisis coming up. I grew up in Switzerland, next to the Lake of Geneva. It's the biggest lake of Europe. It's pretty hard for us here to realize there's a world water crisis coming up. But as I dug into numbers, I realized that, we will be affected in our lifetime. I would say less than 10 years, even in Switzerland indirectly. And that's when I realized that we needed to do something today. And even, I would say we're already a bit late. So I came up with some research, and I realized the refugees were actually one of the first populations suffering a lot from the water scarcity around the world and around the camps, which leads to a lot of illness, even trafficking of water, and I really found it unacceptable. I mean, one of the worst reports I read in a camp in Jordan was that some mothers had to trade their body for water to feed water to their children. So imagine how low this can be. And so I created after that a non-profit organization called Water Inception. And I made it my mission to find a way to bring all those machines to the latest technology we can find to those refugee camps where they lack of water. So you mentioned I'm a social entrepreneur. I started actually as a non-profit. And then I realized, the old model of asking for grants and money from corporate sponsor was a bit old school. We needed to come up with a social business to be able to be self-sustainable. So we started thinking what we could do to fundraise those machines, and I came to realize that looking at how Swiss people consume water, we still consume a lot of bottled waters, water bottles, and actually those numbers are increasing every year. And I think everybody saw on their social network, on your Facebook, on your LinkedIn, that our oceans are pretty much really polluted these days, so we don't need additional plastic bottles, but people will still want to consume more water here in Switzerland. So in order to fundraise our future projects, we come up with the idea to find a new way to commercialize water by creating a new for-profit entity and sell this water for profit, and then with the profit we will fundraise those machines for the people who cannot afford it. So the idea that we have, the concept that we're working on right now is to have a kind of a water box. We call it the Equality Water Box for now. And this box will contain one of those atmospheric water generators, and people here who now carry reusable bottles and things like that will be able to refill their bottles, make a small donation as they buy the water, and pay forward water to someone in a refugee camp. In this way, we'll show that we can sell water in a new disruptive way by decentralizing the water production. The water doesn't need to come from Evian anymore. We can produce a water that has a very similar composition, but it can be created anywhere in the world. And that's what I'm working on, and happy to answer your questions.
Thank you very much, Nat, for sharing this pure innovation and also kind of closing the loop, bringing in how you make it sustainable from a financial perspective also. I think that's something we haven't really discussed yet this afternoon, but we'll come to it. I'd asked a question to Malawi, so I'd like to give you an opportunity to answer that, and then we'll put Slido while Malawi answers the 2 points I had. The first one was on the Ministry of Finance. So how, as a line ministry, do you manage or not to make the case for these issues with Ministry of Finance? How is that playing out at country level? And then also, I know I cut you when you were going to talk about more about your experience on hygiene and promoting hygiene in your country, and you may want to say a few words about that. So I'll give you the floor now. In parallel, I'd like to ask my colleague to put the Slido up so we can see what the questions of the audience are, and then after that, I'll open the floor. Please, on to you, Dr. Do you have a mic? Yes. Slido.
Thank you very much. So in terms of intersectoral collaboration within the country, we have a technical working group. So, and these technical working groups are in different themes. So for example, in HIV, you got a technical working group on HIV/AIDS. But similarly, in issues of water and sanitation, we have a technical working group, which is chaired by the Ministry of Health on the sanitation platform. In terms of water, it will be chaired by the Ministry of Agriculture. Now, within that technical working group, there are our development partners, so UNICEF, water and sanitation, and any the big organizations that are working in these two thematic areas, including Ministry of Finance. And of course, right now, especially with the decentralization, the Ministry of Local Government is very, very important, because that's implementing the major stakeholder in terms of policy direction. So that's where budget lines are developed, priorities are developed, and then monitoring is also at that level. I think let me stop at that.
Thank you very much. And did you want to say a few words on your strategies related to the challenges around hygiene? Did you want to dive a little bit more into that or not? Just because you mentioned that in your introductory remarks, but did you want to add something?
Specifically, I was talking about menstrual hygiene. I think when you look at the SDG 10, now you're looking at inequalities, and the ambassador had already highlighted. What the ambassador made mention was the role of women and the girl child in countries like Malawi. And that touches on the economics of sanitation and hygiene. That as a country, when you go to the demographics, that 52% of our population are women or females. And at school enrollment in Standard 1, the enrollment follows demographics, clearly, 52% girls, 48% boys. But by the time they reach Standard 4, grade 4, which is about the age 9 years old to 12 years old, you find that there's attrition, the girls are dropping off. And by the time they finish their primary school in Standard 8, these girls have gone down maybe by 80%. So you're only getting 20% of those that started in Standard 1. In fact, my colleague here was just highlighting that he can't remember most of the girls he started with in Standard 1. But he could remember those that he did secondary school education with. And where are we losing the girls? One factor that we think in the Ministry of Health is driving the girls to get out of school is the fact that by the time they get to age 9 or 12, the mothers or the family is expecting them to do household chores. And that as a boy child is waking up at 7, the expectation by the family was that the girl child at the same age should have woken 2 hours earlier, gone to draw water, gone to fetch firewood, and the like. So the further water is from the family, the poorer the girl is. So if we can bring water closer home, we can indeed, and the issue about retention of girls is not just about building classroom blocks. Is going to the root causes of why they are getting out of school. So that's the first thing. The second thing that we haven't managed, and the girls are bringing it up now, is that as societies, we've not been open in managing menstrual hygiene in girls. And that by the time the girls are starting to have the menstrual cycles, society has not provided for them to be taken care of in school. So you find that every month, at least a quarter of the time or a week, the girl is out of school, because they can't manage themselves. And so the other area that I thought I saw as one of the agenda items in terms of hygiene is going beyond just issues we're talking about water, but also hygiene in terms of menstrual hygiene for girls. I thought that's...
Thank you very much.
So it's coming out now.
That's very striking. It's something we may not think about at the outset, but it sounds so the correlation sounds pretty evident. But thank you for bringing that up, and I know other countries have brought that up in other forums before. Please.
To address that problem, the government has also intensified the provision of water as well. But because of the resource not being enough, there's still a long way to go. One of the ways is to put boreholes and also to work with the partners, the development partners, to put more and more water boreholes, and in town to put kiosks which are run by entrepreneurs, but the water is provided by the municipal water source. Mm-hmm. But the kiosks themselves in the townships, we call them townships. You have a larger metropolitan area, then you have some areas where people live. So that's another intervention that has been put by government. And another one is to encourage the villages to be able to repair the boreholes. So some of the women and some of the boys have been trained to do some simple repairing of boreholes and water kiosks. And now that the government is determined to put technical colleges in all the districts, this will go a long way, because this is where the skills are going to be developed in simple metal fabrication, building, and so on and so on. So that the building of toilets, the building of anything can be done at the village level, rather than asking a company from the metropolitan place to come and do the repair. So it's empowering the people themselves.
Thank you very much.
Thank you.
Thank you. I haven't looked yet in total detail to your questions, but I have seen a few already that we can, quite a few questions around different partnerships and questions also on the financing of all of this. But before I go into the details of those questions on Slido, are there any questions in the audience to one of the panelists or general comments that would like to be made? Yes, please. And please just in 2 words say who you are, unless that's something you don't want to share. It's always nice to get people's...
No, of course. Thank you very much. It's thoroughly interesting. I'm Peter. I'm just interning here for the year whilst completing my postgraduate. I'm interested because I've done a bit of sort of field work in Ghana, which I appreciate is a completely different area of Africa. But whilst I was there, it was quite interesting to do sort of social and demographic research into Accra and some of the, should we say, floundering areas of the communities. And I was just generally interested to know how much sort of cross-country work there is going on, because you mentioned the cholera outbreak between, 5 or 6 of the countries around that area, and just generally sort of, should we say, horizontal integration or work between the countries, as well as interstate, company, etc. And generally just how much of a sort of a social grassroots initiative there is that's occurring. Thank you.
Thank you very much. Would anyone like to react to that point or comment, or otherwise I'll take a few more questions maybe in the room. Any? Yes, Preeti, you have the floor.
So I'm Preeti Sinha. I run a company called Financing for Development. My question is on citizen accountability, which I have also raised, because I have seen some developing countries, and actually governments do have money for sewage plants, but it doesn't reach the target. So besides that, how can citizens, we don't want to be drinking that water as well. Is there some mechanism in which people can incentivize governments or companies to create more clean water and sanitation? Thank you.
Thank you, Preeti. Anyone would like to react to that question? Cheryl?
Sure, thank you. Is this on? Yes, so I have two interesting examples for that. On citizen engagement, in the project I mentioned in Pune, India, Smart Sanitation City, really what was interesting about how that came about and the leadership of government really looking to partner with the private sector for 2 reasons: to reduce the costs, of the provision of water and sanitation in the city, and provide opportunities for more private sector investment. And a lot of that was around citizen engagement. And so the public and community toilet business models that we're working with in the city right now are all about citizen engagement. What do the citizens want? There is a series of public toilets for women mentioning women's health, and actually very inspiring. What women want is, of course, not what was thought that they wanted by often the men in the positions of installing those toilets. And so it's engaged the community then and a group of young girls to become entrepreneurs to create the toilets for the city that they want. So these are just some of the opportunities, and we're doing that through data. So citizen intelligence, because the citizens are being given that data from the sensors that are being put around the city for the smart city. That information is also going back into the hands of citizens, mostly through the community toilet network. The second example is in Manila, in the Philippines, where this is a private sector investment example where Manila Water is a member of ours, and we worked with Manila Water who were looking for solutions to bring water and sanitation to their last mile customers. And what we ended up doing is a number of things. It was a collaborative innovation project of a number of companies coming together, those that could create the type of toilet that would be affordable and acceptable for those customers, with a lot of engagement from those citizens in the design of their toilet. An innovative financial model between the government and the company in order to provide that service at a much lower cost. And also building around different services around that provision, also that made it more affordable and enabled that customer to have more service. And so that was, I think, a really interesting example of the private sector putting in that investment initially, but relying on partnership with the government to make a new business model work that could provide that provision. And one message that the Toilet Board is advocating is really around those opportunities for the sustainability of these systems. So the so what and the what next of getting access to toilets, how do we make that sustainable? And we believe that there's a role for business to play in helping to create interesting business models, innovative business models that will help to provide the access, provide the maintenance, and the service, treat people like customers, and give them the services that they need no matter what income.
Thank you, Cheryl. I think you really highlighted the power of partnerships there, and how you're working with communities, and how that circle is kind of, the loop is closed. There was a slightly provocative question for you. Can you go, down, Cheryl? Little lower, more. There was
it
one.
a competition?
Yes, the competition.
Maybe Hans, do you want to raise the point?
Was it yours? Sorry, Chelina, can you just go a little, not as fast? Can you just go up there? More. No, it was here. No, low, go more. No, there was one about whether your work is competing with NGO kind of approaches for free services. So how does your work relate to that? So that's a very recurrent question, right?
Yes.
Sorry?
It's there.
Okay, there. Is the work of the TBC in competition to the usual NGO approach of providing free toilets and sanitation to poor communities? Is it complementary? Cheryl.
Well, I think what we would, of course, say is that it's complementary. And I think, our partners, the Toilet Board Coalition is a business-led coalition, but we're 20 partners where equal 2/3 of those partners are governments and large experts in the global sanitation community, such as WSSCC, that is sitting here, WaterAid, and UNICEF, to keep that balance. But where we see the sanitation economy connecting to the current work of governments and NGOs is providing that opportunity for the next step. So where governments and NGOs are really doing the heavy lifting of doing the awareness building, doing the behavior change work that needs to happen, then what? That investment that's being put in by governments and NGOs needs to have an exit. And we believe that exit is through the private sector, that the private sector should then be able to come in and innovate and create the business models that will create a self-sustaining system beyond where we are today.
Okay. Wonderful. So we're really touching here on a point that keeps coming back on the Slido questions, the notion of partnerships, right? So the SDG 17, and in the SDG Lab, we're particularly interested in highlighting what are those sort of transformational partnerships out there with unexpected partners getting together and making a solution more sustainable, just because they're bringing the different pieces of the puzzle together. So I just wanted to ask our panel, whether others, starting from your own mandates and work, whether you have witnessed or whether you have created deliberately such partnerships, or are you intending to put around the table unexpected partners to address these questions? I know this is of interest to the audience, because this is an interest to all of us in this era of the SDGs. And I think even in WHO, the work you're doing, it's a tool and it's a tool you're developing. But to what extent are you partnering or not with unexpected or expected partners to accelerate results in what you're doing? So who'd like to react to this question? Nat.
Thanks. As I said, a year and a half ago, I wasn't really into the water sector. I wasn't in the humanitarian sector at all, not working with any UN departments. But I realized how big the UN was and how many organizations. You even have the UN Water. The first thing I did when I saw this machine, when I came back to Switzerland, the first meeting I had was actually with the UNHCR. And I was like, hey, I have these machines, I found this, I think you should use them in some camps, could save a couple of lives. And first of all, the person in the WASH team he had never heard of those machines, so I was a bit surprised because, I found them, but I realized that they've been existing for almost a decade, so I don't know what the inventors have been doing. I think they stay too much in their garage, maybe. But I think, we need to spread this information. And you talk about kind of strange partnership.
Unexpected.
Unexpected. Sorry, that was.
It can be strange.
And I realized when you start producing water, you can be at the core of many things, and you can do partnership with many things. So of course, toilets is pretty obvious, but of course there's agriculture, and I also looked into hydroponic agriculture. So if you're not familiar, it's growing food with using only water, and growing food this way can reduce up to 90% of the water needed compared to the traditional farming. So it kind of opens up opportunities to grow food in the desert. And then I came across people in the construction, like people building the cities of the future. And we realized, we could just put one of our water generators on the top of a building, and you could have an autonomous building that produces its own water. There's SDG about renewable energies, combining with renewable energies. There's a lot of new models selling electricity in developing nations, pay-as-you-go models, and decentralized electricity production. And I'm like, now we just need to connect with them and start producing water in a decentralized way.
Thank you.
So that's.
Thank you very much, Marina. You wanted to react to this question on partnership, and then I'd love to hear from Bolivia and Malawi if you'd like to react also to this question, Marina.
Sure. So on partnerships, I'd like to give a couple of very different examples. So one, I think UN Water was already mentioned, but because of the SDGs, we have been working a lot more closely with other UN agencies, and maybe this is not supposed to be an unexpected partnership, but the reality is that we often work very much in silos. And being involved in SDG 6 together has really forced us to work together, which I think is a really great thing. Another example is on the initiative that we work on tracking financing at the country level. This is an initiative called TrackFin. It's basically an in-depth study looking at WASH expenditures in country. And the methodology was developed by WHO, but we've had, UNICEF, the World Bank, other partners, IRC, as well as bilateral donors take up this methodology and support it. And we found, for example, to come back a little bit also to your question earlier, Nadia, about advocating for additional resources for water in countries to the Ministry of Finance, for example. The example in Mali that implemented TrackFin
which was actually led by UNICEF in the country. The results were summarized in a policy brief, and the Minister of Water was actually delighted with these results because basically he said, this is exactly what I need to go to my Council of Ministers and say, look, this is what we're currently getting for water and sanitation in the country, and this is why we need more. It's sort of through these partnerships that we build at the global level, but also at the country level, that we are able to produce these types of results that the countries find useful in advocacy.
Thank you. Thank you very much. Natalia, would you like to react to this question?
Thank you. Thank you. Perhaps to come back a little bit to the previous question on some examples on participation, I would be happy to share afterwards some information about our policy on social accountability, on how the entities providing public services are accountable to the public, and there has been a lot of development in my country on the community involvement in these processes. So I'll be happy to share with you. And with regards to partnerships and who is responsible for the activities, I think, I will not make a list because I'm afraid of missing somebody, but for us what is important is that once we have this priority and we assume it as at the highest level of our government, that we engage all who are interested in contributing to it. And I think it has been very useful, the engagement of development banks, development cooperation banks, and also there have been some donors also included. But I think the role of the state has been for us the key component. The state and at the regional level, at the municipal level, that has been the key.
Thank you very much. I'll give the floor to Malawi and then to Rolf, and then also if in the room there are other representatives that like to react to this question. I know there are also representatives of countries that are doing national voluntary presentations at the HLPF. This year, any other person, please just put your hand up because we have another 10 minutes to go, so I'll be slowly wrapping up. So if you have a question or a comment on this question or something else, put your hands up now so I don't forget you. All right, okay, otherwise Malawi on this question, then Rolf, and then it's...
Thank you very much. I think there was a question on cross-country collaboration. In Malawi, in terms of sanitation and health sector, we still work with the WHO. The World Health Organization helps us and leads us. Giving an example of the cholera outbreak, where some other countries thought they would close the borders because they had cholera, or even just like an example of the Ebola, where people without the technical advice from WHO, countries can make really some very hasty decisions. So we have been working hand in hand with the WHO in guiding us on those areas. But locally now we have an African Center for Disease Control. Mm-hmm. So there's an African CDC, and now below that there are regional bodies. Like within the SADC region, we have a headquarters, our center in Zambia. And then below that, there are also bilateral. So this is multilateral, but bilateral coordination between governments. So Malawi and these neighboring countries are working hand in hand. While I'm here, I can actually track what's happening, for example, on the cholera outbreak by a WhatsApp group. And the WhatsApp groups have been in country, but also cross-country. So you may find that neighboring districts have created WhatsApp groups that are also sharing what's happening across and coordinating interventions. For example, if there's an oral cholera vaccination campaign, then they would coordinate that it happens at the same time so that there is no delays in lapses. So I thought I would bring that up. In terms of partnerships, we have partnerships surely with the NGO field. But when she mentioned in Malawi, we're working with Unilever. So Unilever is a private company that is manufacturing soap and other sanitary products. And they've been doing this in a few of our primary schools. I think currently they've done it in total number of students, about 50,000 students, some in Blantyre and others in the capital, Lilongwe. So we are working even with Unilever, which is a purely private institution. And even in the cholera outbreak, during the cholera outbreak, Unilever came up, worked with government to supply soap and other sanitary materials to government or through government to communities. So the partnerships are relatively good. In terms of accountability, censorship and accountability, let me just mention here that government has got structures. We, in the ministry, I would be in the executive arm of government. So I would, in terms of answering, I would be answering to government Minister of Finance, the Auditor General, or whoever would be looking at how I've done my financing. But also I'm answerable to Parliament. So once in a while I get called to Parliament, because Parliament is both the opposition and everybody, and they'll call you and sit you down, and sometimes they'll chase you out and say, you didn't impress us, go back and work out. So that is, I'm also answerable to Parliament. But there are various efforts in various areas that we are working directly with communities where the traditional leader is able to hold me accountable on services that we're supposed to receive. Let me just mention here, one challenge that we've noted in government is accountability of the non-government organizations themselves. They do not tell us what their budget is, and sometimes they do not work aligned to government. So one area that has been very clear also, I don't think it's only in Malawi, is accountability of the non-government organizations themselves.
Thank you very much. I was looking, Rolf, I haven't forgotten you. I was looking at the Slido questions, and I see a lot of them, well, the few that remain are very sort of bilateral questions, so I encourage you to use afterwards the cocktail to go see our speakers and ask your questions bilaterally, if that's okay in the interest of time. Rolf, I know you wanted to react to that question of transformative partnerships or unexpected, strange partnerships was the word. Yes. Please, let me give you a microphone.
Thank you. The sector is very rich in numbers of partnership, but I recently came across one. I'm not sure whether Arthur Wood is here, of Project 1800, but this is a partnership recently formed by bankers and IT professionals that are developing an equity product, a product that can be traded on the stock market that actually invests in the future of water and sanitation. The return on investment in water and sanitation is huge, and as Cheryl earlier said, there's money left on the table. A return of $1 invested of $5 is unheard of. So these bankers, Arthur came up. Arthur was actually the godfather of the development and the social impact bonds. And he pulled a group of bankers together that is actually looking at this mechanism to see if you can monetize the future benefits of investing in water and sanitation. Incredibly promising, because it is unlocking billions, and he claims even trillions of dollars for the SDGs that are in pension funds and in insurance companies. So very interesting partnership. It will take probably another 2 or 3 years, but if that comes to something, then a lot of funding issues will be resolved. Fascinating
you mentioned that, Rolf, actually, because as you know, the Geneva ecosystem in that regard has huge potential in offering that diversity of actors that all have a piece of the puzzle when it comes to addressing the financing part of the SDGs. And the SDG Lab is actually partnering with the Canton de Genève, Sustainable Finance Geneva, and the International Institute for Sustainable Development in using our convening power to bringing all these different actors around the table to see what kind of financial mechanisms could be developed in order to support transformational programs under these goals, but more generally under the SDGs in general, and how can we make bankable projects also that fit the asks of investors, but also the asks of people that are active in development and countries. And it doesn't just happen, right? There's a lot of trust building to be had and a lot of cross-communication to be done. So stay tuned on that work that we're doing at the SDG Lab.
Nadia, could I jump in
yes,
just on
please.
A
Last
comment?
point, and then there's a question. Is it a question or a
yes,
comment?
Sorry.
It's a comment.
Sorry.
Great. I love comments.
No, just to pick up on that, I'm feeling inspired.
Go.
I have a comment and potentially a call to action. But if we look to the other SDGs, I mean, water and sanitation Nation has also not learned from some of the success in partnerships on climate change, for example, on forestry, where global governments, the NGO community and business have been able to work together to create the enabling conditions for private sector engagement and for investment. And I think on water and sanitation, if we could, my call to action here is if we could use this power of proximity that we have via the SDG Lab here in Geneva to go further and learn from these other mechanisms to take, I agree, there's so much innovation that is happening right now in the sector, but is it reaching governments? Is it reaching the right types of partnerships to make this this bigger, faster? So that would be my takeaway from this session is, could we work more together in this proximate way here in Geneva through the SDG Lab to bring some of these
Thank you for
pieces
this
together?
great suggestion, and that's very much in our DNA, right? That's what we do and try to connect people and connect people that will then come up with ideas we may not have thought of, and how can we use the convening power of the UN to do so. So let's continue that conversation. Definitely, that's really what we're here for. Please, maybe if you could just give your name and then your comment, and then I'll slowly wrap up unless there are burning questions or comments out there.
Okay, I'm Eva Barenberg. I'm working for the Secretariat of the Protocol on Water and Health of the United Nations Economic Commission for Europe. And the protocol is a multilateral tool which has many countries. And the notion of ensuring equitable access to water and sanitation has already been an obligation for the countries that are parties to the protocol long before the SDG 6 was invented. So I would like to share that we have a lot of experience with bridging equity gaps and analyzing equitable access, and we have developed tools such as the Equitable Access Scorecard. I brought a flyer on this, and I would like to share the experience that this has been very successful. Countries like it, even highly developed countries like France and Spain, have used it and identified equity gaps. And on the second part, which was a question before, have you come across interesting opportunities for collaboration in the very same context that we were applying this project in the former Yugoslav Republic of Macedonia? The stakeholders, which is usually a group of multi-sectoral stakeholders already, insisted that we should bring in telecommunication companies. And first I was very surprised, because for us it's not the usual suspect, but they were explaining that in their country they had a law on equitable access to telecommunication, and since the companies were implementing it, bringing internet, bringing telephone to the most remote villages, they had two experiences which are very important to make this happen. First of all, they know how to get there and how to make it happen to reach every last village. And second, of course, they have a lot of experience with cross-subsidies, how to take higher tariffs in places where people can afford them, and then cross-subsidize more poor areas. This is what I wanted to share.
Thank you very much. But you just finished beautifully, because that's how I wanted to kind of finish and open, because we never like to finish like on a dead end, but kind of open the conversation. All about daring to share all these great experiences. And I know you all have different experiences out there. And this is what we need to share in the era of the SDGs, right? And this is partly what we do also at the lab. Others do that too, is amplifying those good practices, but also the practices that may not be bringing the expected results we expected. And why is that? What are the ingredients of success and of failure? And in that regard, we have different avenues for you to kind of interact with us, so that we can then further amplify those things. You see a little booth over there. So if you're not absolutely desperate for a glass of wine right now, please stop by there so that my colleagues can interview you and ask you about your experience in a multi-stakeholder partnership that has had, that either has potential to be transformative or has already brought results. So we're really interested in those partnerships in terms of how they accelerate results, and also how they are financed in a way that will allow for such a partnership to make it through the test of time. Because I think what we all learned through the MDG era, there were a lot of phenomenal experiences out there, but very often they kind of fell flat in the end, because we hadn't thought about the whole financing dimension, or we thought about it on the short term, but not on the long term, as Cheryl was saying. So what are those mechanisms out there that will allow for those transformative partnerships, not only to accelerate results, but make it through the test of time? So this is one entry point. The other one, if you're too tired, write to us, so that we can create also on our Twitter account Twitter cards. we're a small team. The SDG Lab is a small team, so there's only so much we can do at this time and age of our existence. But one tool we use is Twitter. We also have, with our partners from UNIS here, an SDG studio that we're more than happy to use also to interview people. So do get back to us so that we can amplify your stories. And we're looking to have, by the end of this year, a critical mass of a few key examples of those transformative partnerships to really illustrate what the spirit of the SDGs is, and so that we can also answer that appetite of so many member states in particular to learn from what's working and what's not working. So please use those avenues. If there are no more questions and comments or remarks, I'd like to close this session by first of all thanking you all for being here this afternoon. It was really enriching, at least for me, and I hope for the audience, to have all these different perspectives on a similar matter. I think we all have a huge common denominator. We just have different entry points to address those SDG challenges and goals. Just to remind you also, if you could just give us your feedback on what you thought of this session, of how we could do better in the future, any other ideas you have, or if you'd like to engage like WSSCC did today together with UNOPS and UN Water on a next So What series, do come to us. But that would be wonderful if you could go on SurveyMonkey to share with us your thoughts. Otherwise, thank you very much to each and one of the panelists. Thank you to the audience. And I'd like to thank also again WSSCC for their presence and for offering us the wonderful cocktail that's just behind for us to have a drink all together now. Thank you very much.